Surgical horror stories, part 2. Actually, it's just talking about some tight situations, ethical dilemmas, medical management dilemmas that I've been in, seeing how you cope with them. Situation number 1. You're working in a small town. A lot of your patients, actually your friends, you socialise with them. You've got to socialise with someone. And you go around to a dinner party with your wife. The hostess, who you know is a migraine sufferer, calls you out to the kitchen during the dinner party and says, look, she's in a lot of pain, could you give her a pethidine shot? Well, you know, there's a bit of a history of abuse here of pethidine, so you refuse to give it. Your wife comes and speaks to you, you're disrupting the whole dinner party, it's a bit of a social catastrophe. So what do? What do you think? Well, I refuse to give it to her. I mean, the medical authorities, medical boards take a rather dim view of you dishing out narcotics without a good reason to do so. But the downside was I completely ruined the evening for everyone. My ex-wife was very angry with me, as were the other guests, but what could I do? Next situation, you're working in a very busy ski injury clinic. You know, there's people all around, you've broken legs, dislocated shoulders, you've just come in from resuscitating someone in the car park. And then you look across that reception and you notice there's a rather well-dressed, reserved, gently spoken man, middle-aged. And something clicks, you know something's a bit odd here. And you put your ear to it and you realise that this is a middle-aged barrister who wants to commit suicide. And this is his last desperate clutch at life or help to come in and get some help. So here you are, what are you going to do? My God, you're surrounded by saving all this life, and now you know that this is going to involve a lot of your time, spending time, counselling, but it'd be much easier just to commit the patient. That means you're allowed to put them to a psychiatric facility for 24, 36 hours, get the police to take them away. But you know, that's rather heavy-handed for such a person in such a situation. So what would you do? Yeah, I agree actually. I just tried to reorganise my day as much as I could. I got him into a side room, sat him down with a newspaper, some coffee and tea, went out setting limbs, suturing lacerations, reducing dislocated shoulders, and just went back and forth talking to him all day long, trying to get a story, trying to be empathetic, trying to give some advice, trying to work out what medication I could do. Then comes the evening, so what do we do there? So I actually went across, had dinner with, he paid, and then I was reasonably confident that he was stable, and I gave him my phone number. He could contact me directly if he was feeling desperate. And then again, I saw him for breakfast in the morning. Again, he paid. And by that time, things had sort of settled down a lot. So what this illustrates is you've got to be flexible. You know, sometimes you think you're so busy, my God, I can't take on any more clinical load. But sometimes you just have to, you know, and somehow work it out. And you know, you usually do. You know, doctors have about 100, 200 important decisions to make a week. Lawyers about 5 or 10, most other people 1 or less. But you know, it's amazing how you actually cope and you actually make good decisions and you do well. Third case, you're a young trainee, you're in a consulting room with the senior consultant. He's an examiner. He can have a lot of sway with your career. He can determine which jobs you get, all this sort of thing, you know. And then he enters into an argument with the patient. Patient's got a problem with their ankle, something's happened. He's had a big argument, he's used some 4-letter words, sort of threaten the patient away. Then he turns around to you and says, nothing you hear in here will leave these 4 walls. So what do? Wow, this is a bit of a tight situation, isn't it? It could affect your whole career. This guy's got a lot of power, he's pulling the levers of power, can cause you a lot of trouble unless you comply. So one way or another, you've got to keep him happy, you've got to obey your ethical duties as a doctor. I know you can be a whistleblower and run and tell all the authorities and be written up in the local newspaper, but sure, you're going to be left high and dry. So this one, you really got to play it sensitively and maybe have a discussion with him later or another colleague who's similar in status to him. Okay, I hope you enjoyed those cases, and thank you for your interest.